Hi viewers, welcome to our Genius Insight channel. Today, we are going to have a discussion on the topic called mesothelioma. Now let's talk about what is mesothelioma. Before we start, please press the like button and subscribe to our channel. Please watch the video completely to know whether you're infected with it and what should be done. Number 1. What is mesothelioma? Mesothelioma is a type of cancer that affects the cells of the mesothelium, a protective membrane that lines many of the body's organs. Mesothelioma most commonly affects the lining of the lungs, but can affect the lining of the heart as well as male reproductive organs. There are two main types of mesothelioma, pleural and peritoneal. In rare cases, mesothelioma can occur in the pericardium, the lining of the heart. This is called pericardial mesothelioma. In even rarer cases, mesothelioma can occur in the membrane around the testicles, testicular mesothelioma. Number 2. What causes mesothelioma? Exposure to asbestos is the most common cause of mesothelioma. Approximately 70 to 80% of all diagnosed cases of mesothelioma can be traced back to some form of asbestos exposure. Asbestos exposure can happen anywhere. Despite it being known to be a dangerous product by the early 1900s, many companies continued to use asbestos. Fortunately, it is only when the asbestos is disturbed that tiny particles are released into the air that can then be inhaled into the body, creating the risk of later developing mesothelioma. Workers in the following industries were, and possibly still are, more at risk due to increased exposure to asbestos products. Construction, roofing, and demolition of buildings. Asbestos is used in insulation and some tiles. Shipbuilding, mining, milling, mechanics. Asbestos is used in brakes. Military veterans may have been exposed in many ways at military bases, on ships, and in construction. In childhood mesothelioma, asbestos doesn't seem to be an issue. Children who have had earlier types of cancer and have been treated with radiation therapy have a higher risk of developing mesothelioma. Number 3. Mesothelioma symptoms. The symptoms associated with malignant pleural mesothelioma tumors may be similar to lung cancer and other conditions affecting the lungs or chest. Pleural effusion, a complication of the disease, is the buildup of fluid in the chest. It may cause difficulty breathing. Other common signs of pleural mesothelioma include 1. Pain. 2. Chest pain. 3. A dry, sometimes painful, cough. 4. Shortness of breath. 5. Difficulty swallowing. 6. Weakness and or fatigue. 7. Back pain. 8. Unexplained weight loss. 9. Common symptoms of peritoneal mesothelioma include 10. Abdominal pain. 11. Accumulation of fluid in the abdomen, swelling. 12. Diarrhea, constipation, or other changes in bowel habits. 13. Unexplained weight loss. Pericardial and testicular mesotheliomas are very rare. Pericardial mesothelioma symptoms may be similar to those of other heart conditions, such as heart palpitations or irregular heartbeat, difficulty breathing, murmurs, night sweats, and chest pain. One known symptom of testicular mesothelioma is hydrocele, which is a buildup of fluid in the scrotum. Number 4. Mesothelioma treatment options. Although there is currently no cure for mesothelioma, active treatment is recommended for some people. This can include chemotherapy, radiation therapy, surgery, or a combination of these treatments. It can help some people to achieve a longer period of control over the disease. The two types of mesothelioma are treated differently. Chemotherapy. Chemotherapy drugs aim to destroy cancer cells while causing the least possible damage to healthy cells. The most commonly used chemotherapy drugs for treating pleural mesothelioma include pemetrexed with cisplatin or carboplatin. Chemotherapy for pleural mesothelioma aims to prolong life and shrink cancer as well as improve quality of life. Surgery. There are two main types of operations considered for actively treating pleural mesothelioma. Extrapleural pneumonectomy, EP, which removes the tumor and the pleura, the affected lung, the diaphragm, and a portion of the lining of the heart, or a pleurectomy with pulmonary decortication, PD, which removes the pleura and as much disease as possible. Trimodality therapy. Trimodality therapy uses a combination of chemotherapy, radiotherapy, and major surgery. It is used to treat some people with mesothelioma. Treating symptoms. When mesothelioma is diagnosed at an advanced stage, the main goal of treatment is to manage the symptoms and keep them under control as long as possible. Treatments can include surgery to improve breathlessness caused by fluid buildup. VATS, video-assisted thoracoscopic surgery, involves removing some of the linings of the chest wall and lung. During the procedure, sterile talcum powder is injected into the pleural cavity, causing inflammation that closes the pleural cavity and helps prevent fluid from building up again. More extensive open surgery can also be undertaken to drain fluid buildup in the lungs or to relieve pain in the chest. For people not suitable for VATS or open surgery, an indwelling pleural drain may be used, which allows fluid to be drained 1 to 2 times a week, depending on how quickly the fluid builds up again. The medical treatment team will discuss with the person suitable treatment options to assist with other symptoms such as sleeplessness, pain, fatigue, loss of appetite, and weight loss. If aforementioned any persistent signs and symptoms you've noticed in yourselves that seem unusual or bothersome, ask your doctor to evaluate them. Tell your doctor if you've been exposed to asbestos. That's it for now. If you have any other opinions about this video content, please write them down in the comment box. Make sure to subscribe and hit the bell icon for the new videos notification. It's not a game, it's a